Welcome to today's Global Summits Podnar. I'm your host, Dr. Alan Chong, a chiropractor, chair of the chiropractic division of Global Summits. And today we have a very special Podnar. Welcome to everyone who's joining us. We have Dr. Krista Burns, who is a chiropractor and another doctorate of healthcare administration, I think. So she'll tell us more about that, and I'm going to do a formal introduction after I screen share a few things about Global Summits. If you're joining us for the first time, and certainly we welcome you. If you're joining us for the nth time, then we welcome you back. So on today's show, today's Podnar, we are going to be talking about the science of good posture. What is good posture? How to become a posture expert if you want to be, or just simply to have some practical advice about how to assume better posture. So as doctors, I'm sure that you realize that posture is very important for health, wellness, as well as for appearance, because people with good posture are known to be more attractive and even more successful, as some of the research might suggest. So I'll be doing the introduction in just a few minutes, but right now I want to screen share and to go through a little bit of an intro and formal introduction about what Global Summits is, and a little bit about me so that you become familiar. And then we look forward to giving you a formal presentation with Dr. Krista Burns, chiropractor and a spine expert. So let me just share here. Let's see. And from the beginning. There you go. So welcome to the Global Summits Podnar, the science of good posture. So Dr. Krista Burns is both a chiropractor and another doctorate in healthcare. She'll tell us more about that for sure. But the science of good posture, there is a science to posture, and we look forward to the details of that and some of the research behind that, as Dr. Burns is not just your average chiropractor. She is an expert in posture. So a little bit about me so that you are familiar with me as your host. I'm a practicing chiropractor of 34 years, AKA known as the Spine Doctor. I run Calgary Spinal Decompression Center here in Calgary, Alberta, Canada, and then 2 other clinics under the brand of Center for Chiropractic Care. So I'm also a practice coach part-time, highprofitspractice.com. If you want to find out more about me and my podcast, who Dr. Burns was a guest a few podcasts ago. We're at 30 podcasts now and over 1,000 downloads. So then you can view that QR code. Just scan that and it'll bring you to the Practice Mastery podcast page. And I'm also, I guess, affectionately known as Forever an Entrepreneur. So I always am, have my hands in different things, hopefully the right things. And then Global Summits is one of those things that I discovered. Thank you for Dr. Keanor Shaw and Dr. Emily Letran. If you're watching this, they introduced me to Global Summits, the great organization, which I'm going to tell you a little bit more about right now. Okay, so Global Summits Institute is doctors uniting. It's all about doctors uniting around the world. So it is a truly global movement. And so I'm the chiropractic chair. What does that mean? That I have been appointed and taken initiative to share to the chiropractic community and other doctors' communities about the importance of coming together on a global front to unite doctors on one front. So we have, as the graphic shows, medicine, pharmacy, dentistry, PhDs of philosophy, optometry, and chiropractic being 6 of the major doctors out there. Certainly there's doctors in other fields. This is an inclusive a group of doctors that is moving forward as a movement. Now, a couple of the initiatives that I want to highlight for you and for you as listeners, viewers to take advantage of is Global Summits Institute has a call for nominations in the fields of chiropractic, optometry, philosophy, PhDs, dentistry, pharmacy, and medicine to nominate either yourself or an esteemed colleague or both to be recognized as an esteemed colleague for your accomplishments. So that is an application process, and I've just posted the link here, top100doc.com/nomination. So please check that out when you have a chance. Now, another initiative that's really exciting is Global Summits Institute Universal School of Healthcare or Health. So the first class is taking up applications now. It is a Doctor of Healthcare Business, and the details are at universalschoolofhealth.com. The dean, Dr. Emily Letran, who is a dentist, has been working extremely hard with others like Dr. Shaw and many others on the faculty to put that together. And it's a very exciting program to help you, potentially you, if you're looking to formalize your business education and to be more successful, more likely successful. It is a formalized program that's easy to take, and it's all online with just a few hours a week, and you can earn another doctorate. All right. So those are a couple of links there. Now, the one common link is through Facebook. And of course, if you're here on Facebook and you haven't been aware of what Global Summits is doing, just search Facebook groups, Global Summits, follow, like, check it out. Then all these different links and such programs are available through searching that through Global Summits on Facebook. So you've probably heard this quote before, pardon me, be the change you wish to see in the world. It was attributed to Gandhi, but he actually said many more things about that, many more specific things, but be the change you wish to see in the world. And that's how I view the global movement of doctors to doctors in global summits. All right. Now about today's speaker, Dr. Krista Burns. Now, Dr. Burns is I'm going to actually flip off of here, but the quick summary is that she has 2 doctorate degrees, founder of the American Posture Institute. She's a chiropractor and chiropractic leader and influencer, and she's an international and a TEDx speaker. Wow, I'm impressed. And she's an expert, and I put just all things posture. She's an expert in all things posture and in community health. And so I'm going to stop sharing right now and give the formal introduction that she is a chiropractor and founder of American Posture Institute. She's also the author of the textbook. Wow, how many authors of textbooks do you know? I don't know that many. The Posture Principles. Dr. Krista has 2 doctorate degrees and is leading the charge against poor posture. So if you're watching and wondering, well, yes, can you fix your posture immediately? Maybe. We're going to see and hear from Dr. Burns all about that. She has also been featured on media including ABC, CBS, NBC, Fox News, radio, and Global Women magazine, and prestigious stages including the World Congress of Neurology and Neurological Disorders and the World Congress of Falls and Postural Stability. So I'll let you take it away, Dr. Krista Burns. Pleased to have you on the Global Summits Podnar, and we look forward to both learning from you as well as being able to fix our postures.
Wonderful. Thank you so much, Dr. Chong, for that excellent introduction. It's an honor to be here today. I'm going to go ahead and share my screen, and we're going to dive right in. So thank you for this opportunity of sharing on the Global Summits platform, where doctors are uniting across multidisciplinary backgrounds. This is an incredible initiative, and I'm very honored to be a part of it. My name is Dr. Krista Burns, founder of the American Posture Institute, and as Dr. Chong had mentioned, I've had the opportunity of speaking on prestigious stages, including TEDx, World Congresses, and spoken at universities and professional organizations around the world. And today, I'm excited to share the same message with you about postural neurology, the good science of posture. You can also check out the Posture Principles, my textbook that we've written at the American Posture Institute, as well as been featured on media. At the American Posture Institute, we are on a mission to reverse postural decline in the digital age, and today you'll find out exactly why. Now, we're going to go through a lot of research studies today, and we're going to go through some practical application that you can take from today's presentation and implement right away with your patients. So whether you're a chiropractor, a medical doctor, a dentist, a physical therapist, any other provider who's watching, you can take this information and implement with your patients to help them improve their posture. So if you want to scan the code to have a complete guide for postural neurology, go ahead and scan now so that you can get the complete guide with the practical implementation. Right now is the best time in history to become a posture expert. Now, why would I say this? Why is right now, 2021, the best time in history to become a posture expert as a healthcare provider? Well, because posture is declining at the speed of technology. Posture is declining faster than we are growing in terms of technology. You know, as if we look at human evolution, it took millions of years to evolve to be upright, going from this position to this position, from more quadruped to a bipedal postural stance, took millions of years of evolution. And then the onset of the digital age, with the onset of the internet, within just 20 years, we've seen the most rampant decline of posture in our history as a human species. So now we're seeing this ultimate postural decline. Now, what I want you to understand about this, and we're going to talk about those specific pathways today, is how this is impacting not just your physical stature, not just musculoskeletal presentation, but also how it's impacting brain function. So as human beings evolved to be from more quadruped to a bipedal stance, not only were we able to resist gravity by balancing our massive bodies over a small base to support our 2 feet, but we also saw an increase in brain size. So from here to here, over the course of millions of years, we saw a tripling effect of brain size. Once we evolved to be upright, from here, we could navigate our world where we had more visual capacity. We could see more in the distance. We could touch things with our hands, which was adding afferentation and stimulation to the brain. And over time, we developed what's called the neocortex. And so our posture is directly correlated to the development of our brain function. Now, if you look at these two images, regardless of your background, whether you're a medical doctor, a chiropractor, an optometrist, whether you're a dentist, if you look at these two pictures here, without knowing anything about this patient's case history, you tell me who looks healthier. Go ahead and type it in the chat, A or B, who looks healthier? And then how about this image here? Who looks happier? If we look at these two images, one with stooped posture and the other with upright posture, who looks happier? And then who looks more confident? Now, regardless of our healthcare backgrounds, we can all agree that if you have proper posture, regardless of if you're in pain or not in pain, if you're having symptoms or not having symptoms, regardless of if you're happy or confident or not, just by having proper posture, we all make the clinical assumption that you are more confident, happier, as well as healthier. Postural correction is an evidence-based need. So let's go through a couple of the research studies showing the impact and the implications of postural distortion patterns and how it's impacting our neurophysiology. So this research study came out in 2014 by Hans Rey, and he is a surgeon who evaluated the impact of Technic Posture on the cervical spine. So what's Technic Posture? Technic Posture is when the head juts forward anteriorly. So if we were to look at an image from the side, we would see that my ear is forward in relation to my shoulder. Now this can be due to one of two presentations. It can be from anterior flexion, but such as looking down at a smartphone, or from an anterior translation with a slight upper cervical extension, such as looking at a computer screen. And so with Technic Posture, what they determined and what they found is that by looking down at our smartphone, it increased the amount of pressure crushing down on the cervical spine. When your head is in a neutral posture at a 0-degree angle where the ears are aligned over the shoulders, the head weighs approximately 10 to 12 pounds. Now, as we go forward from 0 to 15 degrees, that increases to 27 pounds. At a 30-degree angle, 40 pounds. At a 45-degree angle, 49 pounds. And at a 60-degree angle, 60 pounds. 60 pounds of pressure crushing down on the cervical spine. I mean, think about that. We would never imagine going to the gym and those big 60-pound discs. You would never put that on your head because it would be crushing, it would be crippling. The effect of that would be too much for your physiology to handle. And yet, every time we look down at our smartphone in Technic forward head posture, we're adding up to 60 pounds of pressure onto that cervical spine. And then research from 2019 showed the impact of posture and blood flow to the brain. So this research study was showing loss of cervical lordosis is associated with changes of the circle of Willis and cerebral artery hemodynamics, resulting in decreased blood flow to the brain. The researchers then concluded by saying that if we correct the loss of cervical lordosis, we can instantly increase cerebral artery parameters, indicating an immediate increase in blood flow in the brain. So what's a cervical lordosis? Your cervical spine is made up of 7 cervical vertebrae, and we should have a nice natural curve, a nice natural lordotic curve of the cervical spine. As that flattens and reverses, then we have that Technic posture that we were just discussing. So when we have a loss of the natural lordosis, this is impacting the amount of blood flow to the brain. And then posture and respiration. So when it comes to posture, it's not just about the musculoskeletal disorders or not even just about how we look, but how our body is functioning. We're talking the amount of blood flow to the brain, our ability to breathe properly with proper respiration. So here's 2 studies on respiration. Number 1 showing that forward head posture reduces vital capacity for respiration due to abnormal muscle recruitment of the accessory muscles of respiration. So what this means is when I have a slumped forward posture, so I go forward in a Technic posture and my shoulders round forward and I have a postural hyperkyphosis of my thoracic spine. So now I have forward anterior head carriage and I have increased C-shaped spinal curvature of my thoracic spine. As I go forward into the slump forward posture, what I'm doing is I'm reducing the mobility of the diaphragm, our primary muscle of respiration. So because the diaphragm is inhibited, then I start engaging my ancillary respiratory musculature and I become a what? A chest breather. And it looks something like this. As I engage more of my ancillary muscles, my accessory muscles of respiration, and continue to inhibit the diaphragm, not only are we seeing a reduced forced vital capacity, but research study number 2 down here is showing morphological changes of the thorax, causing decreased respiratory function. Now, if we take one respiration and poor posture, it's not the end of the world. But what I want you to imagine is all of your patients who've had chronic postural distortion patterns for the last 20 years. They've been breathing with inhibited respiration, with inhibited functional capacity and respiratory vital capacity. Now, when we continue to be in this slump forward posture, continue to take more respirations but shallower, it leads to what? Hyperventilation. Hyperventilation is associated with stress, increased cortisol output. And so we're continuing to propagate that positive feedback loop of more stress, faster but shallower respirations, hyperventilation, and more stress to the body. And then we look at posture and proprioception. So proprioception is your ability to identify where your body is in space. It's truly the sensory motor integration, taking in sensory input and then integrating with the motor cortex and then having a proper motor response based upon the sensation within our external environment. So what this researcher found in 2020 is that increased use of smartphones with forward head posture has also been shown to significantly impact cervical proprioception. Forward head posture has a negative effect on the muscle spindle activity involved in proprioception, resulting in cervical repositioning errors and deficits of dynamic balanceability. You know, when it comes to our elderly population, one of the greatest inhibitors to their quality of life and their independence is lack of postural stability. When we have decreased postural stability, we have poor balance and increased risk of falls. Now, what really worries me and what I've presented on at World Congresses in Malaysia and in Chicago is that when we see a geriatric patient, we think of what? With a geriatric patient, we tend to think of them being slumped forward with age. But now, if you look at children, even 12 years old, 10 years old, 8 years old, we're seeing that when they're on their smartphones, they present with the same posture as we used to assume was just for geriatric patients. So we're seeing this decline sooner. So we're seeing a decline in proprioception and dynamic balanceability earlier on. This study shows smartphone cervical stress and depression from 2015. Heavy smartphone use may produce considerable stress on the cervical spine. Smartphones can also cause negative effects of a person's psychological status, such as depression. So more time in a seated sedentary posture with slump forward posture and technic posture is associated with cervical stress and increased amounts of depression. And then here, I want you guys to really take this in and understand the importance and relevance of this study here. Now, this is from 2016, showing the correlation of posture and cognition. What is cognition? Cognition is your thought processes. It's your ability to take in information from the external environment and process it within your brain. Now, mobility and upright posture is associated with aspects of cognition, including memory. The results from this study provide the first evidence for a link between postural alignment and cognitive functioning in healthy older adults. So even in healthy adults, if we have a decline in posture, it can impact their cognition. And then the impact of screen use. This research study came out in 2020. And keep in mind, all of these research studies are very new, and some of them were pre-pandemic. Imagine in this post-pandemic world where we've spent even more time on virtual in these seated slump forward postures, how this is impacting our brain and body function. Now, this research study showed that when children are using devices more than the recommended guidelines from the American Academy of Pediatrics, that they were showing a lower microstructural integrity of brain white matter tracts, supporting language and literacy development. So spending too much time on devices seated in a sedentary technic posture is associated with a change in the structure of the brain. Like I said, posture is declining at the speed of technology. While we all want to have nice, beautiful, resilient, upright posture, everywhere we look, it seems that people have become more and more slumped forward. Posture is declining at the speed of technology. And what's really frightening is how this is impacting what we like to refer to at the American Posture Institute as digital dementia. Digital dementia is a collection of symptoms, non-Alzheimer dementia-like symptoms from the overuse of devices, sedentary posture, and poor lifestyle habits. So if you were to look up dementia online right now, if you went to dementia.org, for example, if you look up the signs and symptoms associated with dementia, you would find something along the lines of this. You would see that it's a collection of symptoms. It's not an actual disease process. It's a collection of symptoms associated with inability to focus, with poor memory recall, inability of focusing our eyes on a certain tract. And so we look at dementia, and we used to, clinically as well as just rationally, we thought that dementia only happened in elderly patients, right? And what we're seeing is that with the onset of the digital age, dementia is happening younger and younger for people. And then if we look at digital dementia and we consider all factors, let's pick this apart and see the impact that sedentary posture and too much time on screens is having on your brain and your body. So here's a representation of the brain right here. If we look here, what's the opportunity cost of being seated and staring down at a device in poor posture? When I'm seated, staring down at a device in poor posture, I have inhibition or underactivation of the cerebellum. The cerebellum, located here just inferior to the cerebrum, is a highly metabolic activity area. And this highly metabolic area is responsible for refined motor output. It helps us be coordinated with our voluntary movement patterns. So when we're seated, when we're not moving, when we're sedentary, and we're in the slump forward posture, we're not engaging our cerebellum for refined motor outputs. This is why when you see a child who's been on their device for a couple of hours, they stand up, sometimes they're a little bit wobbly. And then we have overstimulation of the back of the brain here, the occipital lobe. So as you're seated staring at a screen watching a YouTube video, what happens is you're bombarded by incoming visual stimulation. That incoming visual stimulation is collected as light by our eyes and sent to the back of the brain via the optic chiasm and optic nerve. And it's sent to those visual association areas in the occipital lobe. And so that part of our brain, the back part of our brain, is hyperstimulated. It's overactive. Now, as that part is hyperstimulated, we see an understimulation or an underactivation of the parietal lobe and the frontal lobe. So your parietal lobe here has what's called the sensory cortex. Your sensory cortex, your motor map, is where you perceive all sensation within your world. So if you feel something in the periphery, if you feel a sensation on your hand, this information is carried to the contralateral sensory cortex for processing, and you have representation in your cortical map. The more you move, the more sensation you have, the clearer, more defined cortical maps that you have. And then a phenomenon called sensory motor integration happens. So the parietal lobe here has a sensory cortex. And then here in the frontal lobe, we have what's called the motor cortex. The sensory and the motor cortex communicate so that based upon the environmental feedback that you're getting with the sensory input, you create a motor response. So your motor cortex creates a more refined motor output based upon the specificity of the incoming stimulus. And so when we have nice refined motor maps, we create really great dynamic voluntary movements. But when we don't, when we have blurring of our cortical maps, it inhibits our ability to have coordinated voluntary motions, and it inhibits our postural stability. Not to mention, this part of the brainstem called the pontomedullary reticular formation is what's called the powerhouse of your posture. When we stimulate the pontomedullary reticular formation, it helps us inhibit anterior gravity. So gravity is constantly compressing down on the body. Now, we're never going to beat gravity. We'll never get rid of gravity. But what we need to do is position our bodies upright so that we can actively resist gravity. So as gravity is compressing down on our bodies, if we don't have activation of the brainstem, the pontomedullary reticular formation, then we're going to go forward in that slump forward posture. And so we'll have lack of inhibition of flexion from the pontomedullary reticular formation and lack of vestibular activation for upright postural extension. So I know we just went through a lot of neurology. That's why I want you guys to grab that free guide, because it goes through it step by step. So here's what's happening with digital dementia then. Digital dementia is a buzzword for a collect all of symptoms of poor memory recall, inability of focusing, that slumped forward sedentary posture, poor low mood affect after children or adolescents or adults are spending too much time in a slumped forward posture staring down at their devices. According to research in the frontier of neuroscience, this posture right here is the posture of cognitive decline. And when we're walking with our smartphones, we have lack of arm swing. The New England Journal of Medicine shows that when we have a change in our gait position associated with a slow shuffling gait pattern and lack of arm swing, this is considered the gait of dementia. Now, I want you to take a good look at this picture right here. If you looked up Parkinson's disease in any textbook, or if you Googled it right now, this is the classic image that you would see representing Parkinsonian gait and posture. So with Parkinson's posture, you'll notice that the patient has slump forward posture, that they have forward head posture, postural hyperkyphosis, that cervical, that thoracic C-shaped spinal curvature of their thoracic spine. And when they walk, they have a slow shuffling gait pattern and lack of arm swing. Okay, so this is classic Parkinsonian gait and posture. Now, look at Technic Posture. Notice with Technic Posture, I have forward head posture, anterior rolling of my shoulders, thoracic hyperkyphosis, postural hyperkyphosis. When I walk, I have a slower shuffling gait pattern, and I have lack of arm swing because I'm holding my smartphone in place. Look similar, right? Isn't this crazy? So Parkinson's posture and Technic posture have radical similarities. The scary difference is that Parkinsonian gait and posture is in response to a brain decline, whereas Technic posture is creating motor and sensory deficits, feeding the neurologic system. So in order to prevent Parkinsonian gait and posture later in life with our geriatric patients, it starts early, even with our pediatric patients, of having proper posture and reducing this Technic posture syndrome. Also think about how this is impacting your fatigability, your ability to pay attention and stay focused in school or in work, or your ability to focus when you have free time with your family. And now I want to give you guys a practical example here of how posture is associated with your alertness. We've all had that experience where we've started to fall asleep in class. Hopefully nobody's falling asleep here on this amazing podnar. A big thank you again to the Global Summits team for putting it together. But what tends to happen is we get tired and we start to fall asleep. Look at my posture. I start to go forward. Maybe I rest my head on my desk, or I start to slump forward in slump forward posture. Now, I want you to imagine, think about back to university. Maybe you're in med school or dental school or chiropractic school, and the professor sees that you're starting to fall asleep. So you're here in this posture and they call your name. What's the first thing that you do? You instantly sit up straight. You sit up straight so that they don't think that you're sleeping. Now, what does this represent? It means that as we start to doze off and get tired, we go into a slump forward, more primitive postural design. If we want to wake up our brain instantly, we inherently straighten our posture system. And when we have a straight posture system, our brain is alert and active. If you wake up in the morning, what's the first thing you do? Oh, you stretch. You stretch and go into extension to wake up your brain. Now, there's a direct correlation. Remember, I was telling you about a part of the brainstem called the pontomedullary reticular formation. Now, pontomedullary, between the pons and the medulla, there's a reticular formation, a cluster of nuclei associated with descending pathways that go from the brainstem down to the spine. And these pathways, reticulospinal, is going to stimulate the ability to resist anterior flexion. So if I'm resisting flexion, if I'm inhibited in resisting flexion, I'm here, I'm slumped forward. If I resist flexion, then I'm here, I have upright posture. Now, there's also an ascending pathway that goes from the brainstem up to the parietal lobe, to the reticular activating system. So reticulospinal descends, which is a correlation between your brainstem and your spine. And then we have ascending pathway that goes to reticular activating system. We all know what the reticular activating system is and does. It keeps us alert. It keeps us paying attention. When we activate our reticular activating system, we're focused and we're alert within our environment. So there's a direct correlation between your posture system and the alertness and awakeness of your brain. It's no wonder that when adolescents and adults are spending so much time on their devices, then it's like they're in a tech trance. We've seen it all before. We've seen it like zombie posture. It's almost as if people are walking around like zombies in this tech trance because they are outsourcing their brain to their devices. They are in a slump forward posture, and we have less activation. And a very important process that takes place early in life is called synaptic pruning. So synaptic pruning takes place at about age 7 to 10. What happens up until that point of development is you have synaptogenesis. So a creation of so many beautiful synapses within the brain. Everything you're learning in the first 2 years of life up to about age 6 or 7, you're creating synapses after synapses after synapses and reinforcing the synapses that you use most often. And then what happens after this rapid brain growth and development is a process called synaptic pruning, where you go through and you get rid of the synapses that you're not using enough. And so we have pruning out of the synapses that we use less often. Now, what worries me is that children, from a developmental perspective, imagine the generation before today's current generation, is in those first 6 to 7 years of life, children were outside playing. They were activating their brains by having human touch and physical contact and running and playing and stimulating the brain through what we would consider from our experience a normal development. Now, if we look at modern day children, that between that 0 to 7 years of age, so many of them are spending all of their time on devices. And then when synaptic pruning takes place, we're pruning out the less reinforced systems. And we could be pruning out the important synapses associated with better posture, better mobility, and better balanceability. If we look at the recommendations of the American Academy of Pediatrics policy statement, they recommend that for children 2 to 5, limit screen time to 1 hour per day of high quality programming. So up to age 5, just 1 hour per day, and it's got to be high quality. And then for children 6 and up, establish consistent limits on the time spent using media and the types of media. Now, prior to 2020, the recommendation previously was no more than 2 hours per day. Now, with the onset, certainly of the pandemic, everything's happening more virtually. They modified these recommendations, but it's still saying that it needs to establish consistent limits of the time spent using media. Now, we recognize that we have to have some time on media, and I'd be a hypocrite if I said, all children need to throw their smartphones away, because we're connected right now via digital technology. However, there's consistent limits. Now, if we look at how this is impacting their life, if we're recommended to, from age 2 to 5, have 1 hour of screen time per day, and then have it consistently limited after that. If we look at the averages, American children 8 to 12 years of age are spending 4 hours per day on screens, and teens are spending on average 7 hours per day on their screens. And that doesn't even include homework, okay? So that's 7 hours of scrolling on their screens that's impacting their development. Children instead should be outside playing a minimum of 2 hours per day. What happens to our neurology when we're outside playing? So imagine playing tag. And as you tag your friend, you're getting stimulation that goes to your contralateral sensory cortex. As you run, it's a voluntary motor pattern. It's cross crawl. It's stimulation activation from your motor cortex down the corticospinal tract to your end organ musculature to create that voluntary motor pattern. Your ipsilateral cerebellum is engaged and active in refining that motor output. So when you reach out for a tag, you're accurate with your tagging ability. Or if you miss, then that's feedback, that's learning that we missed our target, and next time we need to be more specific with our movement. As we're upright, instead of falling over when we go for a tag, our ability to stay upright is the vestibular system, stimulating postural stability, upright postural extension. Our visual system is engaged to look in all fields of gaze, looking for our friends, looking for somebody to reach out and tag. The sensations of the environment are, we can feel the wind on our skin, we can feel, we can smell, we can see around us. We're igniting our sensory cortex with all kinds of activation. So this is what we would consider from our generation normal development. And now we're seeing lack of stimulation besides from screens during the developmental periods for pediatric patients. So instead of being outside playing for a couple hours per day, we're seeing this instead, flexor dominant posture. And it's not just the kids, it's certainly the adults as well. Technic posture is the posture of neurological decline. But postural neurology is the solution. So today I want to provide to all of you practitioners some practical application of how you can take this important understanding and knowledge and evidence-based information of how slump forward posture in a postural hyperkyphosis and technic posture is impacting your patients, and give you practical applications so that you can start making changes right away with your patients. Now, as a reminder, we're going to go through a lot of practical application. If you want to download the free guide, all of it will be there for you, covered in the complete guide to postural neurology. We'll go back through those pathways, explaining the neurophysiologic connection, plus you'll get the complete guide going through that practical application as well. So go ahead and scan that to get the complete guide to postural neurology. All right, so let's get clinical. Now, one of the important concepts that I want you to remember is that your brain is like a muscle. If you work it, it grows. If you don't, it atrophies. And so we have to, as practitioners, we have to evaluate where the deficits are in the neurologic system. And then we want to reinforce those deficits of the neurologic system with specific clinical application, with specific exercises, neurorehabilitation that are going to stimulate that part of the brain. Okay, so your brain is like a muscle. If you work it, it grows. If you don't, it atrophies. We're going to present to you what's called the eye-spine vestibular treatment protocol for postural neurology for brain-based correction of postural distortion patterns. So eye-spine vestibular, an overview, and then we'll zoom in on each of these parts of the brain and neurophysiology. So if we look at the eyes, eye-spine vestibular, eyes is the visual system. The role of the visual system in postural neurology and upright postural design is orientation and head posture. Orientation and head posture, how we orient ourselves within our environment, and our head posture, keeping our eyes parallel with the ground and with the horizon in front. And then the spine. The spine is the motor pathway. It's a freeway system of incoming sensory afferent information and descending motor output from the brain down to the brain back down to the body. So your spine represents sensory motor integration for the incoming afferent information going to the sensory cortex, and the descending motor output from the motor cortex back down to the body. And then the vestibular system represents upright postural stability as well as balance. So if we have deficits of the vestibular system, what do you naturally think of? You think of a patient like with vertigo, with motion sickness. So if we have a decline, even a minor deficit in the vestibular system, it impacts our balance and postural stability. It also stimulates upright postural extension. So to prevent that collapsed forward posture position, we need to stimulate the vestibular system to bring us into upright posture. So let's talk about each of these individually. The spine is for sensory motor integration. So we have our spinal column, which protects our important spinal cord. The spinal cord is the connection between the brain and the rest of the body. So the central nervous system connects with the peripheral nervous system via the spinal cord. Now we have incoming afferent information. So if I feel a sensation here on this right side of my body, it's going to ascend and cross over in the brainstem or at the cord level. And it's going to be interpreted in the contralateral sensory cortex. Then with sensory motor integration, the sensory cortex communicates with the motor cortex and creates an appropriate motor output. Now, as I mentioned previously, within your sensory and your motor cortex, you have what's called your cortical maps. You have your sensory cortex, your sensory homunculus, your motor cortex, your motor homunculus. Now, if you guys think back to med school, chiro school, dentistry school, you probably all remember that funny model that we had to learn, which was, it was a model of a man who had a big head, big lips, big hands, small torso, big feet. That's because within your cortical map, you have more representation for the areas that have the most afferentation. Now, what is afferentation? Afferentation is incoming stimulus. When you move, any change in joint position or proprioception is sensed within your cortical map as afferentation, as stimulation to the cortical map. So the more you move a body part with mobility, then it's going to have that refined motor output, that refined section within the sensory cortex, which then communicates with the motor cortex for more refined motor output. What tends to happen with a lot of the patients that we see from a rehab perspective is they come in and they're, maybe they're antalgic and they're going, I threw my back out, I can't walk, or I've had back pain for the last 10 years. And of course they want it fixed right away, but we know that it requires consistent stimulation to the cortical map to produce clearing of the cortical map so that we're not having blurring of that area. Because what happens is if we have an injury, we're going to splint the area that's injured. We're going to offset that tissue with lack of motion, and then we're going to have increased motion in other parts of our body to compensate. So what happens within the brain is the brain is going to give its resources to the areas that we're moving the most. And so, for example, if you were to hurt your wrist, and to save your wrist, you were using your fingers more, your elbows more, you'd have more pronounced cortical maps of your fingers and your elbow. So then to rehab the wrist, we've got to move it consistently. Okay, that's why it's not a one and done treatment protocol, because we've got to rehab that area of the body to rehab the brain. And when we have better inputs, we create better motor outputs via sensory motor integration. And then I want you to consider the visual system for head posture and orientation. So head posture and orientation. Now, our visual system is how we orient ourselves within our environment. We have the ability of scanning our environment in all of the different fields of gaze. Now, when it comes to our visual system, we will always prioritize vision over our posture system from a survival perspective. We prioritize vision over posture. That's why so many of your patients have postural distortion patterns, because they have a deficit of the visual system. And when I say deficit, I'm not speaking from an optometry perspective of needing to change their prescription. I'm speaking from a postural perspective of a deficit of the oculomotor muscles moving the eyes within the orbit. So when we have a deficit of the muscles moving the eyes, then what we'll do, instead of, if, for example, I can't look to the left because I have a deficit moving my eyes to the left, what do I develop instead? A head rotation. Okay. If I can't bring my eyes together for convergence, I develop a head rotation and or a head tilt. If I'm having difficulty seeing with accommodation near and far, then I squint forward in a forward head posture. So the visual system has a direct impact on head posture, because if we have a deficit of the visual system, how we orient ourselves will be prioritized for vision for survival over the posture system. And so we'll collapse our posture system in order to see better. And with the visual system, we are trained that if we see something in our environment, we'll instantly look to it. If I can't quickly move my eyes to the side, then I'll change my posture system. I'll literally change my entire posture pattern around my ability to see a stimulus. And so if our patients present with chronic neck pain, if they have headaches, if they have, if they have chronic tightness in their shoulders, we've got to look and see if they have a visual system deficit. And if they do, we've got to clear that up in order to improve their head posture position. So with the visual system, I want you to think about the correlation between the visual system, your vestibular system, and your cervical spine. So descending from your brainstem, you have within your brainstem, you have visual nuclei and vestibular nuclei. They're going to descend together via a tract called the medial longitudinal fasciculus. And the descending spinal pathways from the visual and the vestibular system are going to go where? To the cervical spine. They go to the cervical spine and they communicate with the cervical proprioceptors. And so based upon our ability to see and orient ourselves within our environment, it can have a positive or negative impact on our posture system. And we have head posture distortion patterns. Again, we may present with a head rotation, a head tilt to one side, or a forward head posture presentation. So if we suspect that the patient has head posture distortions, we've got to check the visual system. One of the best ways of checking is with an eye convergence test. So with an eye convergence test, we're testing the patient's ability to bring their eyes together at midline. So how you can perform this is with a pen or just with your fingertip. slowly bring your pen or fingertip into the patient's just about to their nose. And what you want to check for is their ability to bring their eyes together at midline, converge. Now, if it's a positive test, what you'll see is that one of the eyes will diverge. So usually patients can bring their eyes in, but then it'll fatigue and you'll see one eye go out to the side. So it'll diverge, it'll be a divergent eye. Now, if we see a divergent eye, then we also need to consider from a divergent eye perspective, then considering if it's, so if we see a divergent eye, then we want to determine if it's fatigability. And so if it's fatiguing, then what we want to do is we want to correct their ability for convergence to improve their head posture correlation. So again, sorry, just to quickly analyze that again. So when we see the eyes coming together with convergence, we want to see if they come together at midline. If we see a divergent eye, we want to rehab the divergent eye to bring it back into midline. If not, it may create a head tilt or a head rotation. And then next, you can perform small eye circles as a rehabilitation protocol. So small eye circles are going to bring the divergent eye into convergence. So for example, if I had an inability of bringing my left eye into midline, what I would want to do is do small eye circles in front of my right eye. As I'm following my finger with the small eye circles, it's creating a convergence of my eye. Now, we want to instruct the patient not to move their head, because if they move their head in a rotation towards the side, then they're creating a head rotation. If they keep their eyes center and they perform small eye circles off to the side here, okay, small eye circles, now I'm converging my weak eye. So as I'm converging my weak eye, I'm building neuroplasticity, I'm building strength of those muscles that are going to bring the eye into midline. And if we don't, then we'll continue to have a divergent eye, which can be associated with postural distortion patterns of the cervical spine. And then the vestibular system. So the vestibular system is so fundamental to postural correction. Now, our conversation today about posture would be very incomplete if we didn't really dive into the vestibular system. So what is your vestibular system? Your vestibular system is important for balance and upright extension. Now, within your inner ear, you have receptors called your otoliths and your semicircular canals. Your semicircular canals are going to activate with spinning or rotation movements. So if I'm moving in a rotation period, or rotation phase, then that's going to stimulate my semicircular canals. If I change my verticality, if I change my posture position in relation to gravity, that'll stimulate my otoliths. So if I change my verticality, or if I have an acceleration or deceleration, that stimulates my otoliths. Now, this is important because the vestibular system is activated if we change our posture in relation to gravity so that we can make postural adjustments. For example, we can put our hands out if we think we're going to fall. If we're going forward, we can stimulate the posterior paraspinal musculature to go up into upright postural extension. Now, that's going to keep us within equilibrium to prevent things like vertigo and motion sickness. In addition, it's going to help stimulate upright posture. So when it comes to stimulation of upright posture for the vestibular system, within your brainstem, so within the pons of the brainstem, you have vestibular nuclei. Those vestibular nuclei are going to descend via the lateral and the medial vestibulospinal tract, lateral and medial vestibulospinal tract. Now, your medial vestibulospinal tract is going to go to your cervical spine. So it's going to communicate with your cervical proprioceptors and your visual system for upright, proper posture of the head. Now, you also have the lateral vestibulospinal tract that will descend from the brainstem down to the spine. This is going to stimulate upright postural extension or extensor tone. So if I have this posture here where I have that slump forward postural position, by stimulating the vestibular system, the lateral vestibulospinal tract, that's going to stimulate my extensor tone. So anytime you're working with a patient who has slump forward posture, it's going to be incomplete care if we don't get to the root cause, which could be lack of vestibular stimulation. So we need to do more extension exercises. So if your patient has a head posture distortion pattern, work with the visual system. If they have a thoracic or a postural hyperkyphosis presentation, you've got to work with the vestibular system. A great way of stimulating the vestibular system for balance is working with single leg stance or one leg balance. So we want to see that all patients have the ability of balancing on one leg for up to 30 seconds of proper posture. If they don't, we want to continue working with their balanceability. If they can do this, we want to continue building neuroplasticity and challenge them. So if I can hold proper posture while balancing on one leg for 30 seconds, then challenging them by having their eyes closed or by doing this on an unstable surface. This is going to lead to better balanceability. So So check for one leg balance. And if they sway, if they have postural sway while performing one leg balance, they'll have postural sway towards the side of deficit. So train them by having them do one leg balance. If you were working with an elderly patient or a more neurologically compromised patient, then have them start with their hand against the wall. And instead of bringing their knee up to 90, have them just bring their ankle off the ground. Once they can do that, bring the knee up to 90. Once they can do this, take the hand off the wall. Once they can do this in proper posture, have them close their eyes. And then from here, an unstable surface. Continue to work with that vestibular system. Also integrating postural extension exercises. So a great one is a Superman exercise. So for example, if you work with patients, a lot of our chiropractors who are tuning in, if the patient is lying face down as you come in the room, instead of having them just lay there mindlessly, have them perform an upright extension. So have them pull their shoulders back, engaging the extensors, the paravertebral extensors of the thoracic spine. As I hold this position, I'm holding upright extension. It's a reverse posture exercise. Instead of being here in a curled forward, slump forward posture, we're going into a reverse position where we're doing a reverse posture exercise to go from flexor dominant into nice upright postural extension. Have them hold this exercise with a nice isometric contraction, perform 3 repetitions holding for 30 seconds. If they can't do 30 seconds, start with 15 seconds and then 20, 25, working up to 30 with 3 nice strong isometric repetitions. And then in addition to working with the visual and the vestibular system, we want to integrate posture habit re-education recommendations. Now, all of us, whether you're a practitioner or with your patients, for yourself or implementing with your patients, consider these important posture habit re-education recommendations. Number 1 is to reduce screen time and notifications. Remember, especially for our adolescent patients with those developing brains, we've got to limit the amount of screen time media. I like to call it digital detox doses, where you encourage the family to make a media plan where they're going to dedicate 3 hours per day where the whole family is tech-free. They're going to find a place to charge the phones or plug in the computers and leave them all in one area where the whole family enjoys 3 hours of tech-free time together. My recommendation is the first hour when you wake up, the last hour before going to bed at night, and then for an hour around the dinner table, enjoying fun family time and reducing that screen time. Also engage in active sitting. With active sitting, it's an important activator for the vestibular system. So you've all seen those exercise balls, and at the American Posture Institute, we recommend posture cushions. Now, we recommend a posture cushion because you can easily place it on any old chair. Anybody can bring it, to work or to school and sit on a posture cushion. Now, what happens with active sitting is when I'm seated on an unstable surface, I actually risk falling off. So if I plop down in an old chair, the chair holds me upright. That's why I can literally drift off to sleep in class and the chair will hold me up. I don't have to engage my posture system. Whereas if I'm on an active sitting solution, if I'm seated on an exercise ball or a posture cushion, if I start to slump or slouch to the side, then I actually risk falling off. And so my vestibular system activates because I've just changed my verticality in relation to gravity. And so my vestibular system activates, it brings me back to center where I centralize my posture. And now from here, I maintain nice upright postural design. This has also been shown to help with children who are suffering from ADHD. It helps them pay attention better by engaging their brain and their body by being on an unstable surface, by engaging their posture system with active sitting. I also recommend taking frequent posture breaks. Now, everybody who's joining us live on Facebook, I want you to perform this with me right now. Bring your arms out to the side, press your chest forward, and drop your head back. And just hold for 30 seconds, focusing on your respiration. What you're going to notice is that you feel nice and stretched out. So these flexors that become so tight become nice and stretched out. You feel like you're dropping your head back, whereas normally it's crunched forward. Your thoracic spine is a nice extended position instead of being curled forward, postural hyperkyphosis. Have your patients and yourself perform this for 30 seconds every hour of your workday, especially if you're on devices. This is going to reverse the force of gravity. So instead of being here, flexor dominant, we're bringing the body into nice upright postural extension. So perform a posture break for 30 seconds every day or every hour of your workday to stimulate that vestibular system for better posture. Thanks for joining us on this amazing podnar. You really can grow your practice with postural neurology. You see, with postural neurology, you can stop guessing and start knowing. There has never been a better time in history to become a posture expert. We owe this to the next generation. We owe it to our patients, and we owe it to ourselves. Because a change in centimeters can change your patient's life. A change in centimeters from here to here from slump forward posture to beautiful, upright, resilient postural design can dramatically change the rest of their lives. We owe it to our patients to become posture experts. If you're interested in becoming a go-to posture expert, I encourage you to check us out at the American Posture Institute. Over the last decade, we've had the opportunity of certifying more than 10,000 practitioners in this system of postural neurology. So if you're interested in becoming a go-to posture expert, please check us out over at the American Posture Institute. You can scan this QR code right here. And as promised, we want to make sure to give you the postural neurology guide for free. So we've had the opportunity of connecting today via Facebook Live. Let's stay connected and let's see how we can help you get breakthrough results with your patients by integrating postural neurology into your practice. Whether you're a chiropractor, medical doctor, optometrist, dentist, then we can show you those great strategies of instantly correcting posture to help your patients have better breakthrough results. Thank you again for this opportunity. Dr. Chong, I want to give the floor back to you, and I appreciate the great work that everybody's doing over at Global Summits.
Well, that was more than awesome, Dr. Burns. Just a ton of great material. Obviously, just a fraction of your textbook, but some really current knowledge, learning for us as non-posture experts. I mean, I am a posture expert and but not a certified posture expert. So those couple QR codes you can just review, go back in the video, the Facebook Live, and catch those QR codes if you want to catch that, as to how to become more information about how to become a certified posture expert. Correct, Dr. Burns?
Absolutely.
And then for sure to please pick up the free ebook information on the different postural aspects. So I do have some questions before we wrap up. We've got a few minutes more. Excellent presentation about a lot of things, especially the science and the neurology, which posture is actually just a representation. I like to explain to my patients and clients that posture just reflects what is going on in the body for alignment and function. Now, a question I have is what you mentioned earlier in the presentation, digital dementia. Tell us more about the potential impact and what is actually happening, do you think, in the world today of tech, and especially with our kids. Let's talk about our kids. If you have children, the concerns about that.
Yeah, so if you follow the National Institute of Health, right now, they're performing the largest study in history of the impact of screens on adolescent brains. And it's a 10-year study where they're following, I believe, more than 11,000 children over the course of a decade. So it's going to be brilliant when these results come out. Now, they've already released preliminary results from this study. And what they found is that when children spend more than 7 hours per day on devices, then it's changing their brain structure. What we're seeing is a decline or thinning of the cortex, meaning, to put in layman's terms, that we're having a shrinking of the brain. So we're having decreased white matter of the brain, spending more than 7 hours per day on devices. Now, in addition to that, if we're seated and sedentary while on devices, which is what we are usually, we want to get people up and moving, like I'm standing right now as presenting while I'm engaging with technology, but most people are seated in a sedentary posture. So not only are we seeing thinning of the brain cortex, but lack of stimulation of the cerebellum, of the vestibular system, the frontal cortex, the frontal lobe with the motor cortex, and the parietal lobe with the sensory cortex. So we're seeing an inhibition of activation of the important areas of the brain for activation, for learning, for thinking, for cognition, for being creative, for motivation, as well as for movement patterns. So where I see this impacting children, and it'll be amazing to see over the course of a decade how much of change that we're going to see. But I truly believe that we've got to keep kids moving and keep them upright while engaging with technology, so that at least we're stimulating the parts of the brain that are going to stimulate motor patterns as well as thinking. So that research study that I shared about cognition and poor posture, when I'm in the slump forward posture, it's associated with a decline in cognition. So I'm using the back part of my brain instead of the front part of my brain, my prefrontal cortex, for thinking. And if I'm on a device in poor posture, I'm outsourcing my brain to that device, and I don't have stimulation of the prefrontal cortex. Also, I want you to think about the anatomy of the brain. Within the frontal lobe, you have your motor cortex. Within your frontal lobe is where you also do your thinking, your thought processes, your cognition. So if we're moving, then we're stimulating the part of the brain that we use for thinking. If we're seated, sedentary, in a slump forward posture, we're not stimulating that part of the motor cortex. And so by having active upright posture and limiting screen time, my humble opinion is that we will help prevent this collect all symptoms of neurologic decline associated with what we call digital dementia.
Right. So for as adults and as we age through the natural course of aging, it's been speculated that this sitting, I mean, at one point in time, this is old news, but sitting is the new smoking. Well, less and less people smoke, certainly. But the whole point of that comment in that headline was that sitting is actually causing us early aging and perhaps premature morbidity and death. So how would you say that sitting, no, let's put it this way. How would you say that standing desks and modified standing desks, because you don't necessarily have to go out and buy one, can be utilized, and how are they benefiting us?
Mm-hmm. Yep, I love that. So yeah, sitting has been branded as a new smoking. My belief is that our chairs should come with labels on them. If they did, we'd stand up more often and we'd have better posture throughout the day. Now, it's not about standing all day long. So for example, if your patient comes in and they're a lower back pain patient, the last thing that we want to do is, if they've been seated for 8 hours a day for the last 20 years of their job, is recommend that tomorrow stand for 16 hours. They're going to feel feet pain, they're going to feel lower back pain. We've got to start integrating more movement throughout our day. And that's where standing desks come in. So it's an ideal ratio of 3-to-1, 3-to-1 of standing to sitting. So if I'm standing, if we look at an hour, for example, standing for 40 minutes, seated for 20. So we're giving our posture system a break as well. Now, go ahead.
That's an excellent recommendation. And, one of the things I say is the advantage of a standing setup, and I'll say setup as opposed to necessarily buying a formal setup, because you can rig it up at a bar area. You can even rig it up with a laptop and such, with a separate keyboard, separate mouse. Go on about the specific recommendation of the 3-to-1.
Yeah, and it's just about having that sit-stand capability, like you mentioned. So many people, especially during 2020 and early 2021, we went from our typical working environment to suddenly working at home. And we had to make quick adaptations in order to save our posture system while working from home. Now, 64% of people were presenting with musculoskeletal disorders, such as neck and back pain, while working from home. Why? Because most of us were at the couch in the slump forward posture position. As you mentioned, you can grab an Amazon box, you can grab some old textbooks, put them underneath your device and bring those devices up to eye level. So you have that sit-stand capability where you can continue working, but you can work from a working height while standing. So with sit-stand capability, strive to have a 3-to-1 ratio of standing to sitting. While seated, I highly recommend an active sitting solution. So like I recommended, you can use an exercise ball or a posture cushion. Now, in the workplace, some places won't allow you to have an exercise ball because it rolls around the office space. That's okay, grab a posture cushion. You can put a posture cushion on any old work chair, and that's gonna be a perfect sitting for active solution, a perfect solution for active sitting. Now, if we need to increase our movement, then that's going to be a great way of still moving while sitting. Because as I mentioned, if we start to slump when we're on an active sitting solution, we can actually roll off. This is good. It challenges our physiology. Any challenge to physiology can create neuroplasticity. And so it stimulates our vestibular system to bring us upright, balanced, and back to center. The same is true while standing. Then we're balancing our body over our base of support, as we're designed to do. We're designed to be upright, dynamic human beings. If I'm standing, I'm moving more often, versus seated, sedentary posture, where I'm outsourcing my posture system to my chair to hold me upright, and I'm outsourcing my brain to my device to entertain me, to educate me, to think on my behalf.
Right. So for people who don't know, and I use one, this is an example of basically a squished ball type of arrangement. If you can see that, it's a little bit tricky. There we go. This is one example of a cushy type of active sitting, and I definitely, it helps me decrease back pain, as well as it keeps me moving. So the key is to keep some movement, right?
Absolutely.
During that that work or studying or online school. I mean, those are huge factors. So that also can reduce, alertness and reduce boredom. So I have another question. So you made this statement, which is very fundamental and important. And I want you to expand on that a little bit and reiterate: better inputs equal better outputs. I mean, that's, you know, kind of we've heard garbage in, garbage out, and then ideal inputs and better outputs. Talk about a little bit more about that again with regards to good posture versus bad posture.
Yeah, great question. So better inputs equal better outputs, and what that refers to is sensory motor integration. With postural neurology, we have a 3-component system: eye, spine, vestibular. So if we hone in on the spine is going to be the freeway system, our pathway system of ascending incoming information going to the sensory cortex contralaterally, and then descending motor activation going from the motor cortex on the contralateral, from one side to the contralateral side of the body to control voluntary movements. So the reason better inputs create better motor outputs is because we have more clear, more refined sensory motor integration. So for example, if you can clearly understand an input, you can clearly understand the best output to create for that. We also talked about, one of the research studies was about proprioception. I believe it was from 2020, and it was showing that there's more density of cervical proprioceptors within the cervical spine. And when there is forward head posture or postural distortion patterns of the cervical spine, then that's impacting the density of the muscle spindles, which is creating lack of proprioception, which is joint position error. So we're having an error of repositioning our body in proper posture based upon the fact that we have postural distortion patterns, and that continues to propagate unless it's corrected. So better inputs, an example of a great input would be like vibrations therapy, doing whole body vibration, doing a chiropractic adjustment, doing reverse posture exercises to correct postural distortion patterns, doing acupuncture treatment, doing massage, spinal decompression. All of these are considered inputs to the system. So whatever your treatment modality is, that's an input that goes to the sensory cortex to be interpreted and understood. And then it creates better motor output because we have a good incoming input, creating a better motor output as a result. This is why a lot of practitioners, if you work with the physical system, if you do any body work, you'll see that you do a spinal alignment treatment, like for example, our posture experts do, and the patient stands up and they're instantly 2 inches taller. That's because they had a good input resulting in instantly in a better motor output. And when it comes to working with the neurophysiology, what's so cool is you should see instant feedback. So we have short-term and long-term neuroplasticity. Short-term neuroplasticity means that we should see an instant change. Now, it's not to say that that's going to last forever. That's why we need to do multiple treatments with patients to create that more long-term potentiation. But we should see instant changes in the physiology. So if you've done something right, if you've given a good input, you'll instantly see a better output. One of the things that we test for is if they have postural instability, we'll see anterior postural sway and then do a treatment and then recheck with what's called the spinal push test. And then we'll see lack of anterior postural sway because now we've had a change in the physiology, resulting a better input, resulting in a better motor output.
Wow, that's phenomenal. So any other closing, certainly the invitations, you've had a couple invitations. One is to check out your certified spine expert program and your website, which I'm going to share right now, is you can go to this, let's see, this right here, contact here. You can scan the QR code, right?
Mm-hmm.
And let's see, right there, scan that QR code. Otherwise, do you have that slide right up? What's your valuable resource that basically outlines, yeah, there you go, scan that.
Mm-hmm. Yeah, so to learn more from us, at the American Posture Institute, we are on a mission to reverse postural decline in the digital age. We can't do it alone. That's why we're always welcoming practitioners into our community. A great way to get started is to download this free guide. It's going to go through a reference of what we went through today. It'll go through the pathways showing the connection between posture and your neurophysiology, and it'll give you those practical takeaways of assessments and corrections that you can start implementing right away with your patients. And also, if you want to join us in our Facebook group, then we have a great Facebook group for like-minded healthcare providers just like you to join us. So this is a great place to get started. Go ahead and grab that free guide.
Awesome. So that's pretty well a wrap. I mean, there's great content. You might even want to watch this again. I mean, just the neurology of posture, how it relates to being active, keeping active, not only at a desk, but also in your daily life. And I love the advice that you gave about just taking 30 seconds to a minute to do that extension, chest up and out, arms out, and you know, the head extended to fire those proprioceptors and just get out of that forward flex position into that extended, more anatomic and better postural position, right? I love that. And if there's one takeaway, that's the one takeaway I take away today, and that you can as well. So Dr. Krista Burns, thank you we're gonna stop screen sharing now. If you wanna stop that, exit full screen. Yeah, so thank you very much for being a guest on Global Summit's Podnar. We look forward to your further input and involvement. And for you as viewers, remember that check out Global Summits on Facebook for more information on the Doctor of Healthcare Business Program, as well as just becoming involved as various different doctors. And most importantly, you know, great content like this, please share it. It's so easy to share now with your friends and colleagues that need to hear this stuff and to help them improve their posture in the science of good posture. So thank you very, very much, all viewers and listeners, for today. We appreciate your following, and stay tuned for more Global Summits Podnars and some great topics coming up in the weeks to come. Bye for now.